My name is Martin Lamarre, Martin Lamarre for the intimate. I'm French-Canadian, I'm from Montreal. You can call me Marty, it's much easier. It's been my fourth new beginnings over here. I've been in practice 19 years, so it took me a while to finally realize where I was standing and everything. So what better grounds to just tell you a little bit more about my story, what got me into chiropractic, and so on. Tell me if this sounds familiar. Chiropractic chose you. You didn't choose chiropractic. Heard that before? I was doing sprint racing canoeing in my younger years. I was on the provincial team. I was on the junior national team. I had hopes for the Olympics. And an injury floored me. So that put an end to those dreams and everything. Back then it was diagnosed as low back pain and something, a back sprain, I don't remember. Anyway, nobody could help me. Nobody could help me. We went everywhere until we found this ad in the local newspaper, chiropractor specializing in low back pain and everything. So at the time, my parents, what do you have to lose? Let's go. So we went, spoke to the guy. I was very impressed with his bedside manners. I mean, he was phenomenal. You know, he was the first one that got genuinely concerned as to what had truly happened. He was trying to understand the mechanism as to how I got injured and so on. And I remember it to this day. He sat me in this room and there was this old video playing. It was the Renaissance video with the voice of Peter Graves in the back, you know. So I listened to this and so on. He leaves me alone. My parents weren't with me at the time. And I was 15 years old. So I get out of that room and he comes back in. And he said, so what do you think about that? I said, all right. He says, what do you think we're dealing with in terms of the problem? I looked at him straight in the eye and I said, subluxations. And then shivers went up my spine, and everything. And he just looked at me and says, you know what? You understand more than most of my colleagues at that point. Let's get you on that table and get you treated. So this is how my journey in chiropractic started. So at that point, I enrolled in chiropractic college. Did like everyone, went through the loopholes and so on, established practice. A very good practice, actually. It led me, I don't know if you're familiar with the Canadian Football League or Professional Canadian Football League back home in Canada. I was the team chiropractor of the Montreal Alouettes for 9 years. So that being said, I worked alongside physiotherapists, massage therapists, and so on. And I did that for 9 years. It was a good gig. I liked it. I appreciate it. And it was funny because you're in that room, you're in the training room, and you're treating athletes, you're treating professional football players. I could see about 30, 35 players during 1 hour while the physio guy, while he was setting up his ultrasound or whatever, could see one patient. So I was always getting the, how the hell is he getting these people better, you know? But we did it. This is what chiropractic is about. And anyway, all that led for me to something was wrong. Something didn't feel right, you know? And it was during a casual conversation I had with the head trainer at some point where he proposed that I should keep the manipulation, that's how he called them, about in a span of 3 days before the actual game, just in case players would suffer the ill effect or the repercussion of a bad adjustment or so on. And right at that point, I had my epiphany, my call. I mean, I'm going to spare you the vocabulary that came out of my mouth, but it was an F that ended with a K, U, and I resigned on the spot from that position. So at that point, that was 2012, I went back to my books. I went back to the green books, opened up the green books, started reading, and one thing led to another. I enrolled into the Academy of Chiropractic Philosopher. I wrote the thesis on it, and so on. And that was like what Dr. Cordero referred to as earlier, a defining moment in my life. At that point, just like the first gal that preceded me during this stretch of new faces, you realize why you're here. You realize why you're doing what you do. This was my call, my innate call me at that point. So the subject of my thesis, I have it right here, just so I don't mess it up. Has principal chiropractic's philosophy been its limiting growth factor in clinical practice? And what I was wishing to debate during that thesis was why the abandonment of those principles will lead chiropractic to its demise. Okay, chiropractic will not exist if it wasn't for its philosophy or its principle. E.A. Morinus, I think that's how you pronounce it, said it very eloquently when he said, dispossessed of its philosophy, chiropractic is dispossessed of its uniqueness and perhaps its existence. Okay, and that's exactly what it is. You need those principles, okay, to be there. I mean, just look at what's happening outside our world right now, you know. I mean, kids are being denying care and so on. So you got to stand for something. So the problem with that, but it's not a problem, but what we're confronted with is oftentimes chiropractors have to pick a side. You're either a principal chiropractor or you're whatever else you want to call yourself, you know, a mixer or something else, okay? You can be a little bit of both, but you cannot really truly live the principles if you don't own the principles, if you don't understand the principles, okay? As a principal chiropractic, your mission, your duty is to locate, analyze, correct vertebral subluxation to optimize nervous system function to make sure that innate can do what it has to do. As a mixer, an allopath or something, all you do is treat musculoskeletal conditions and you diagnose. This is not chiropractic, folks. This is medicine. It has nothing to do with chiropractic. It has nothing to do with what our calling is, okay? So who's right, who's wrong? We don't know at that point, you know? It's an open debate, but what it led me to believe or appreciate is that as a vitalistic or principal chiropractor, it's my doctrine of life. This is how I live my day-to-day life. I breathe this thing. You know, I get up in the morning. This is why I'm here in front of you talking. This is my passion. You know, as a mixer, I mean, I guess it's the quest to be socially accepted that's stronger than the will to understand the principles that allows you to call yourself a chiropractor. Never forget that. You know, never forget where you come from. Never forget that some people stood and made this profession happen, and we're still here, strong and alive, perpetrating that message of wellness, of wholeness. You know, this is what we want to do. So basically, if you don't know where you come from, or if you don't know the principle, how do you know if you're still on path, you know? Dr. Strauss says it best at some point, you know? Let me just get to my notes here. Actually, before I speak about Dr. Strauss, okay, there was also during my thesis, there was another article that opened up my mind. You know, it was an article that was published in JAMA, Journal of American Medical Association. I'm going to read it, okay? It was entitled, Why Patients Use Alternative Medicine. And the author came to this conclusion. Along with being more educated and reporting poorer health status, the majority of alternative medicine users appears to be doing so not so much as a result of being dissatisfied with conventional medicine, but largely because they find these healthcare alternatives to be more congruent with their own values, beliefs, and philosophical orientations towards health and life. So this got me thinking. What if our colleagues, okay, chiropractors, they had the same apprehension, okay? It's not because they're disregarding the philosophy or the principle, it's because they just don't understand it. And since when you don't understand something, you don't own it, then you want to fit in, you want to be accepted, so you kind of disregard it. I guess it's human nature to be apprehensive about what we don't understand. So I urge everyone to dig into those books, try to understand more what our philosophy is about, what everything we stand for is about, okay? This is it. The profession is there, and this is what we want, okay? So Dr. Strauss, I'm going to go back to that quote, okay? That's what he said in his book, Higher Grounds. When someone attacks or approaches our profession, the profession's journal, okay, the philosophy, we should see it as an opportunity to express our philosophy rather than get all bent out of shape because someone had the audacity to question the philosophy of chiropractic. Those who attack us should make us stronger. They should challenge us to think about our philosophy and to find better ways to articulate it. Do you get that? Find better ways to articulate it. Whatever it is, okay? You don't have to be like an eloquent speaker. Just speak the truth. Speak your mind. Speak with your heart, okay? There's no doubt in my mind. There's no doubt in my heart. No doubt in my soul that these principles, this profession is what needs to be done, okay? Someone at a seminar I was in last week just said this. We are the answer. We are the answer, okay? Principal Chiropractic is here. It's alive and well. I mean, just look at this room. It's filled with very successful individuals. It's amazing being part of your tribe. You guys are my tribe, okay? I love everything you stand for. I love everything you do. Most of all, I love each and every one of you. This was my 2 cents.